And moving on to the tricep, cranial nerve 6. And you should see the arm jerk out just like it did. Do the same on both sides. And moving on to the radial. This one's a little harder to find, but the arm should supinate. And we're going to move on to, that again is cranial nerve 5. We're going to move on to the knee here. And you should see the legs jerk out for cranial nerve L4. And then to the Achilles, where you should be able to see a dorsal movement of the foot. And then finally, checking for the Babinski reflex. So I pick her leg up, and with the other end of my reflex hammer, running my hammer across and up and down her foot. On a small child, the foot should, the finger should, toes rather, should splay, and the foot should go back. On an adult, you should see the foot actually move forward, which it did. I'm going to move from there to looking at Sade's station and gait. So I'm going to have you stand up, Sade. And just close your eyes for a moment. You can see that she can stand perfectly upright. She's not leaning to one side. And open your eyes. If you could just walk out for me in a straight line. Okay, good. And then walk back just on your heels.
Like this? Like this?
Yep. And turn around and walk on your toes. Good. And now walk back to me heel to toe. Out. And she is able to do all of those tasks without falling over, without wobbling. You can go ahead and hop back up. We're going to move from there to looking at her head. So on the cranial nerve video I uploaded, we looked at Perla, which is looking that her pupils are equal, round, reactive to light, and accommodate. So I'll sort of go over that quickly, but we can see that her pupils dilate with the light, and that when you shine the light in one, the pupil of the other eye also dilates. We're looking at for any drainage, any injury, redness. Can I remove your glasses here? You can gently pull the conjunctiva down, look and see that that is moist and pink, see if there's any extra redness. I'm looking at the scleras, noticing that they are nice and clear and white. And I can go from there to looking at the nose, and again seeing that mucous membranes look moist and pink. There's no excess drainage, that the septum is midline. Looking at her mouth, you can open and say ah. Again, mucous membranes nice and pink and moist. There's no drainage coming from the ears. No lesions, no areas where the skin is not intact. If you can turn your head that way, I can look at her jugular vein. I'm noticing that there's no what we call JVD, jugular vein distension. Go ahead and look the other way. Again, I'm looking at the same thing. And then you can palpate for the carotid arteries. You want to make sure you do these one at a time. Never occlude both carotid arteries at the same time. A person can faint that way, fall out that way from lack of blood flow to the head. So I'm feeling that her carotid artery is nice and strong, steady bilaterally. And I can also listen with my bell to her carotid artery. And I'm listening for bruits, which you don't want to hear, and I'm not hearing those. Moving on from there to her chest, we're looking at the respiratory system. I'm going to start by palpating, and I can feel now for crepitus, which I'm not feeling. That would be kind of like a crackling under the skin. I am not feeling any vibrations. I'm also looking at her, noticing that she's not in a tripod position. There's no retractions. It doesn't look like she's using accessory muscles. She's not struggling to breathe. Again, palpating on the back. I can palpate 6 positions here and 4 on the back. 4 on the front. And moving from palpation to auscultation. So I'm going to be listening with my diaphragm to 6 positions on the front, 8 on the back, and then I'm going to listen to the flanks on both sides, 2 on the left and 3 on the right. So on the front, you usually want to go start above the clavicle, and you're going to go over, down, over, kind of zigzagging back and forth like that. We're going to listen to 8 positions on the back, and I'm having her breathe, take nice deep breaths in and out. Make sure you have your stethoscope in correctly. And then if you want to lift your arms up. And I should have started on the right there, that way you can go back and forth and end on the right. But basically when I'm listening to her lungs, I'm listening for any adventitious lung sounds. So I'm listening for rhonchi, I'm listening for wheezes, I'm listening for any crackles, anything abnormal, which I'm not hearing.
Any abnormal characteristics of your skin. You are fair skinned, some very small nevi. I'm also going to inspect and palpate your head. I'm feeling for contour, any lumps or bumps to indicate any previous or current trauma. I'm also inspecting the scalp. I'm looking for lesions, nevi, scaling, and then her hair is fine but thick and evenly distributed. So moving on to the next part of the exam, we will assess some of your cranial nerves. I'll give you instructions and just follow along. If you have any questions, feel free to stop me and ask any questions. So the first one is cranial nerve 5, the trigeminal nerve. We're checking the motor aspect of this. If you can just clench your jaw while I palpate your temporal and temporomandibular joints. Great. Open for me, please, and shut, and then open against resistance. Good. There's no clicking or crepitus there. The next cranial nerve we are assessing is again cranial nerve 5 trigeminal, but the sensory aspect of that, in which we use 2 objects, a soft and a hard. So what I want you to do is to close your eyes and point to the area of your face that I touch you on, okay? Mm-hmm. Good. And we'll move to the hard object. Okay, you can open your eyes. Now we'll assess cranial nerve 7, the facial nerve. So for this, if you can just first squeeze your eyes shut, don't let me open them. Good, you can open. Raise your eyebrows. Good, smile, frown, puff out your cheeks, and stick out your tongue. Move it side to side. Good, that also assesses for cranial nerve 12, which is the hypoglossal nerve. Next is we're assessing cranial nerve 11, which is the spinal accessory. Can you look to your left? I'm going to place my hand on your cheek, and I want you to move your head to the right against the resistance. Good. And I'll do the same on the other side. Good. Then I'll put my hands on your shoulders. If you can just shrug against the resistance of my hands. Good. Perfect. So next we'll move on to the eye portion of the exam. First, I'm just inspecting, again, the symmetry of eyebrows, eyes, eyelashes. Sclera is white, conjunctiva is pink. I'm palpating the lacrimal ducts and sacs. There's no excessive tearing, no erythema, no dryness. Next, we're going to assess for cranial nerve 2, which is the optic nerve. This is visual acuity. For this, we use the Snellen chart. So I'm going to step back a bit. I want you to cover one eye and read out loud the smallest line that you can.
EPTZO.
And then the other eye.
EPTZO.
Perfect. So that is 20/30 on the Snellen chart. Next, we're going to assess cranial nerves 2 and 3, optic and oculomotor. We're checking papillary, pupillary reaction to light, both direct and consensual. And then the other eye, direct and consensual. Good. The next test, part of the test, tests cranial nerves 3, 4, and 6, which are the oculomotor, trochlear, and abducens. This is your extraocular movements. If you could just follow my finger. Good, and then follow it in. This is for the near object test. It tests for convergence and accommodation, also cranial nerves 2 and 3, optic and oculomotor. Good. The final one is for peripheral vision. We use fields by confrontation. So I'm going to be moving my arms. If you can just tell me when you see my fingers come into your field of vision.
See them? See them? See them?
Good. So now we can move on to the fundoscopic exam, starting with your left eye. I'm going to find, and for this exam, I would normally turn off the lights or dim the lights, but for purpose of the videos, we'll keep them on. Find the red reflex, follow it in so I can visualize the optic disc, margins are sharp, macula, arterioles, and veins. And then the other eye, red reflex, follow it in, optic disc is sharp, margins are sharp, macula, arterioles, and veins all visualized. So that concludes the eye portion of the exam. The next one we'll do is your ears. First, again, I'm inspecting for symmetry. I'm also palpating for any tenderness or pain. We're going to assess cranial nerve 7 or 8 rather, vestibulocochlear. For this, we're going to do a whisper test. So I'll come over here. I'm going to press on your tragus and whisper a word. I want you to repeat it, okay?
Elephant.
Good. And then on the other side,
Hospital.
good. We'll then go to the Weber test. This test for lateralization of hearing or loss. I'm going to place the tuning fork on the top of your head. Tell me if you hear it in both ears, no ears, or one ear.
Both.
Good. And then the Renee test for the comparison between air conduction and bone conduction. I'm going to put it on the mastery process. Tell me when you no longer hear it.
No.
And do you still hear it?
Yep.
Good. And again, on the other side?
No.
Good. So now we can move forward with the auditory or canal exam. I'm going to pull the auricle up and back to straighten out the canal. I'm looking for any foreign objects, cerumen, erythema, edema. I can visualize the tympanic membrane. It is pearly gray, and the cone of light is at 7 o'clock. And over to the other side. Again, pulling up and back, visualizing any foreign objects, edema, erythema, cerumen, tympanic membrane is visible, pearly gray, with the cone of light at 7 o'clock. Good, so that concludes the ear part of the exam. Next, we're moving on to the nose. I'm inspecting the external part of the nose, any lesions or break in skin. I'm palpating your frontal and maxillary sinuses. I am, if you don't mind just flexing your head back a little bit to visualize the inside. I'm looking for the turbinates. Oral mucosa is pink, no septal deviation, no discharge or draining. And then the other side, again, no septal deviation, turbinates are visible, no drainage, oral mucosa is pink. I'm also going to test first for the patency of her nares. Sniff, please. On the other side. Good, and then we'll test cranial nerve 1, the olfactory nerve. This is for smelling. For this test, I want you to close your eyes. I'm going to put a scent under your nose. Hold one side of your nose shut and tell me what you smell.
Peppermint.
Good, and then the other side.
Peppermint. Orange.
Good, so that concludes the nose exam. I'm going to inspect your mouth next. I'm looking at your lips. Lips are for any cracking, lesions, dryness, etc. You can open for me. Stick out your tongue. I'm looking on the sides of the tongue, top lifted up. Good. Oral mucosa is pink. There are no lesions on the tongue or buccal areas. Dentition is good. I see no signs of decay. Say after me. I see the rise of the soft palate. The uvula is midline. Tonsils are absent and pillars are present. Swallow for me. Good. So I just assessed her cranial nerves 9, 10, and 12, which are the glossopharyngeal, vagus, and hypoglossal. So next I'm going to move on to the neck. I'm looking at the skin for any discolorations, torticollis, lesions, which I see none. Trachea is midline. I'm going to move towards the back and do a posterior thyroid exam. If you could just swallow for me. Good. Isthmus is palpable, thyroid nodes are not.
All right, I'm gonna have you follow this pen for me real quick with your eyes.
Alrighty.
Perfect. And I'm gonna shine this bright light in your eye, and you look at the tip of my ear right here, okay?
Alrighty.
Can you cover your right eye with your hand real quick? Perfect. Okay, and then other one. Awesome. So your hair looks like the growth is pretty good. It's pretty even throughout. Do you have any bumps or any cuts on your head right now at all?
Nope.
Okay.
Not that I know of.
Okay. Can I have you smile big for me real quick? And a big frowny face. Really get that lip out there. Okay. And then stick your tongue out for me. Go ah.
Ah.
Perfect. Cool. All right. Now we're done with the bright lights, okay?
Alrighty.
So I'm gonna have you do a little of these with your neck real quick, kind of just testing the range of motion of it. Can you look up and down? All right, and then side to side. Sweet. So I'm gonna put my hands on your shoulders real quick, and I'm gonna push down, and I want you to push up against them, okay?
Alright.
Are you pushing up?
Yep.
All right, now down. All right, do you have any weakness or tightness with that?
Nope.
Okay. So I'm gonna feel your lymph nodes on the back of your neck and then kind of towards your chest area down here.
Okay.
When I'm looking for, when I'm touching your lymph nodes, I'm kind of just trying to see if any of them are swollen, and everything's good. Perfect. All right. So next, I'm I'm gonna take a look at your arms. So if you could you pull up your sleeves a little bit? Perfect. And can you put your arms out like this? And I'm just gonna feel just to check the temperature, and also while feeling your skin and checking it out, I can see how well you're hydrated at the same time.
Awesome.
But you have good skin turgor, and your hands may be a little bit cold. Were you outside earlier?
Yeah.
Alright. Do you usually have that little redness on this when you poke?
Yeah, if I'm like outside or something, I will.
Okay. Can you flip them like that for me? Perfect. I see this shoulder is a little red like you were talking about earlier.
Okay.
Do you have pain with me doing this? Touching it at all?
Not right now, no.
Okay. Perfect. So I'm going to squeeze the tip of your fingers right now. What I'm checking is how well your circulation is.
Okay.
And if you're going to see your fingers turn white, and come back with the red. Perfect. Now I'm going to check your radial pulses, which is right there on your wrist.
Yeah.
Awesome. Cool. Sweet. Now next, I'm going to give you these two fingers, and I want you to grab them.
Yeah.
Yep, like you're milking a cow. Not up and down, but just squeeze them.
All right.
And I want you to pull my fingers towards you. And now push against them. Perfect. Cool. That's just testing your strength and how well your muscles are activating right now.
All right.
Cool. I think we're good with your arms now, and we're ready to move on to your chest.
All right.
Cool. Let me find my stethoscope real quick. So I'm going to have you lay back in your bed real quick
Okay.
while I listen to your lungs and heart sounds. Are you having any shortness of breath today or trouble breathing?
Nope.
Any like racing heartbeat or? Okay, good. All right.
Got me over here. More.
Yeah, that's perfect right there. Cool. And so first I'm just going to listen to your heartbeat and just try to be as still as possible. Okay, and then now I'm going to have you take a couple deep breaths for me while I listen to your lungs.
All right.
All right, and you can start.